Hello, this is your brain on drugs, and this is the punk rock psychiatrist. So today, back to the season on ADHD. Um, I'm going to start working through a treatment algorithm today, and we're going to talk about the non-pharmacological treatments. So first, before we get into those, talk about what are the treatment goals. I mean, it's pretty simple, right? So you want to reduce the pervasiveness of the disease, frequency and symptoms, and degree of impairment, improve quality of life, reduce disability short and long term. I mean, to me, that's kind of very generic treatment goals that you would have with any disorder, right? And then let's talk about the treatment algorithm in children and adults. So I'm going to go through in depth all the medication stuff. So this is kind of how to step through it. And I'm going to talk about the non-pharmacological stuff today, and then we'll talk about kind of the nuances of how to prescribe, like what med to pick, what dose, what timing, how to change it, like how to deal with certain issues with it, and then we'll talk about the like 50 different medications, and there literally are like 50 different um, at least formulations of a couple of different medications. So, um, with kids and adults, it's a pretty similar treatment algorithm. Um, this is this is actually adapted from. This is pretty old, 1999. I don't know where this 1999 came from. It says the Texas Children's Algorithm Project for ADHD from 2007. And then I've got the American Academy of Pediatrics ADHD Clinical Practice Guidelines from the Journal of Pediatrics 2011. I think this stuff is still pretty relevant, even though it's been 15 to 20 years since those dates. So stage one would be psychosocial interventions, and stage zero. We'll talk about stage zero today, the psychosocial interventions and the other, all the stuff that could be out there and what you might want to consider that's not a medication related thing. Um, then after you've kind of exhausted that, or that's not working out, um, then you move into medications. And stage one would be a stimulant. And then stage two would be the other stimulant. We basically have two stimulants. We've got methylphenidate in all of its forms, and then we've got the amphetamines in all of their forms. And there's a lot of different forms that they come in, and we're going to go into depth on that probably in a month or two. When I get through a couple other things, we've got obesity stuff in there as well. We're flipping back and forth. We'll start talking about those, but for me, it's always first line is either methylphenidate or an amphetamine. And then the second line is the other one. All right. And then I've got stage three here using an alpha 2 agonist or atomoxetine, which is a norepinephrine reuptake inhibitor. But, you know, there's nuance to the stimulant one and two. Like, if you might want to change to a different formulation of one of, stimulant one or two, you might want to do a longer or a shorter acting. You might want to switch to a different form, like Adderall versus Vyvanse, something like that. So you're not necessarily just going to go, say methylphenidate 1, Adderall 2, atomoxetine 3, right? It's more like we're kind of we want to prove that the two stimulants are not going to work before we move on to other stuff. So yeah, stage three, I've got alpha 2 agonists. So that's basically like clonidine or atomoxetine. Intuniv would be in that category. Stage four, we're looking at bupropion or a tricyclic. And honestly, I would never use a tricyclic. I don't know if people still do this. They have so many side effects, and they're like so like not very effective, and there's so many better options. Even I see bupropion used first a lot of the time, and I really don't care for that. Like if you think someone has ADHD, You probably should not be using bupropion first. It's more like something I would use if I didn't know what they had, or I wasn't sure, or I was using it for another use and thinking, well, it might also help with this kind of thing. But if I'm primarily looking at ADHD, um, and then also, am I going to use bupropion fourth? I'm probably going to try and get this other stuff to work first. I never use bupropion by the for ADHD. I like if I do, it's because I'm treating depression or smoking cessation. And I'm like, well, they've got a little bit of minor ADHD stuff like going on, so that might be another thing there. But if I'm like, no, this person's ADHD, I'm not going to use bupropion. It's just there's very few instances where I would do that. Or it might be they're coming in, they think they have it, but I'm not that convinced. That might be a time where I use bupropion, but like I'm never gonna like. And then also, if they failed Adderall and methylphenidate, I'm not gonna be like, well, they might bupropion might work. It's like, yeah, right. If those didn't work, then nothing's going to work. So I have treated this a lot in adults, and I can tell you that I've never used bupropion as a primary treatment. It's always been like I said. All right, and then I've got stage 5 here. Use something from stage 4 that you haven't used, or a combination. I'd probably go with the combination therapy, honestly, before I would even go with like bupropion, and I would not use a tricyclic, because stage 5 is saying use something not used in step 4. So it's like if you use bupropion, use a tricyclic. No, I wouldn't. I'm going to try, like, we have so many options on stimulants, so many. Um, I think I mean, we're talking about kids here. I'm going to talk about the adult one. It's a little bit different algorithm, but like, I'm going to be able to find some kind of stimulant that works. I've never not been able to. I've never had a problem with it. I've never had someone that I thought had ADHD, they wanted treatment, and I could not find some kind of stimulant that, I'll just, I'm going to address, like, why did it not work? If it was ineffective, then something else is really, really not going to work. If it's some sort of side effect or, tolerance issue, I'm going to figure out how to dose it differently, or give them a slightly different type of medication that might address that. And so we'll probably get into that at some point once we've learned about the meds. All right, so let's look at the adult algorithm. This one came from a CDC website, probably not up there anymore, but that's where it originally came from. And it's very similar. Stage 0, psychosocial intervention. Stage 1, stimulant 1. Stage 2, stimulant 2. Stage 3, atomoxetine. Notice we don't have the alpha 2 on here. Those aren't, I believe those aren't approved for adults. It might be recently that they may have gotten some, but at the same time, might I consider it? Heck yeah, I might. Why not? And the thing about like an alpha 2 agonist, that might be more likely to be something I add on rather than as a primary treatment. Atomoxetine is not something I would add on. I mean, in talking about atomoxetine, I believe atomoxetine, don't quote me on this, but I believe it was the first treatment that was approved for adults. And then I think it was Adderall XR. But I could be wrong about that. So I never use atomoxetine. I mean, there's a reason why the things I tell you that I never use, there's a reason why I don't. It's because I've used them in the past and just didn't find them all that useful. And now, do I get patients that are on these? Yeah. And what's happening there is another provider is afraid to give the patient a stimulant because they're worried about all of the potential adverse effects, which I'm not really worried about. And they want to give them something that's not a scheduled substance, that doesn't have this potential of dependence, right? And so I'll get patients that are on atomoxetine, and the thing is, you may get here's one where you might actually do this. If the patient doesn't want to take the stimulant, if they're like, I've heard about Adderall, I've heard about Concerta, and I'm afraid of them. I don't really want to take them. I'm worried that I'll get addicted. That's when I'll give them something else, right? If it's not going to be coming from me, I think in the majority of cases, it's coming from the provider that's afraid to give them the stimulant. Um, when we're not afraid to give a lot of other stuff, and in my opinion, these are way less risky. There's probably people out there saying, you're crazy. And it's like, I've treated hundreds of patients. I've never had people coming in early asking me for stuff because they ran out of it or they lost it. I mean, has that happened before? One or two times, and then I just didn't give it to them. I'm very clear. Like, and because it only happened one or two times, I think that maybe they did lose it. But at the same time, I don't want to set a precedent where that's going to happen, right? I had one guy, he was really nagging me about it, and I was just like, this is the dose you're getting, this is how often you're going to get it, and this is how we're doing it. And if you misplace it or lose it or whatever, or run out before I think you should have, that's just something you're going to have to deal with. You don't need to take this every day. And so I can think of one patient I had that issue with, and I dealt with it pretty easily. And then I gave he was like on the dot every 90 days asking for it again, and I'd give it to him. And because I'm in the military environment, which is also useful, these people are closely watched. And so I think his work and colleagues and stuff probably would have noticed if he was like downing the whole thing at once and acting like a crazy person. So that is another reason, like in the military where I've done almost all of my practice, it's just a lot less risk that people are going to, and not that people in the military don't abuse things. It's just that there's things that they're more likely to abuse and less likely to abuse, and things that will be more noticeable if they do. And I felt very comfortable doing this the way I did it, and still do, because I still do volunteer and see a few patients. And I have actually one patient that I recently started on Adderall, and this is a case. This is a guy who was on Wellbutrin and Lexapro, and he actually does not have depression and anxiety. He has ADHD, and so I put him on Adderall, and he like quickly got way better. And then there's all these side effects he was having from these other. I mean, I replaced Wellbutrin immediately. I basically I cross tapered him from Wellbutrin onto Adderall XR, and then I'm weaning him slowly off of the Lexapro right now because he was having adverse effects. We're not really sure if it worked. He did have depression. I think the ADHD had a lot to do with it. I think a lot of social factors had a lot to do with it. Perhaps it was useful for a period of time, but he's doing better now. But he still has the ADHD, and I'd like to just have him on that. So that's a case of a patient who was put on bupropion for ADHD. It didn't really help that much, and there's something out there that helps way better, and he's doing really good with it. And then I can talk about another patient with the atomoxetine, came to me on atomoxetine, and didn't really like it, didn't like the nausea, but said his comment was, I don't like it, but I need it. And he didn't want to take a stimulant. So I was like, if you say you don't like it, but you need it, and you're going to tolerate this the negative side of it, and you don't want to try something else, that's a patient that I'm perfectly fine giving atomoxetine to, right? And so that's why I put it down third, fourth line. It's because it's not going to work as well. But if you have a patient that, for whatever reason, doesn't do well with the stimulant, or is concerned about addiction issues, or you are actually really concerned about addiction issues, and we'll talk about this later. There's actually studies to show that people have addiction issues do better if you treat their ADHD with stimulants than if you just don't give it to them. Then they go out and find amphetamines and meth on their own. There's actually a treatment out there for meth use disorder that's a combination of like methylphenidate and something else to try and get them off of the amphetamines that they're abusing. So that's what that's what I experience, and that's what I have seen. So there are patients that I will do the atomoxetine on, but we will talk about this more later. I want to get into the non-pharmacological stuff. So other things you can use for adults: modafinil off-label. We unfortunately can't really give it to kids because there was some signal of Stevens-Johnson syndrome. We'll talk about this later, but that signal doesn't exist for adults, so that is an option. Clondine, guanfacine, intuitive, right, is in there. It's off-label. You could consider it for an adult. Bupropion, venlafaxine, I despise, so I would never use that. And then discipramine, that's probably my favorite TCA because of the least side effects. But like I said, TCAs for ADHD are just not something that I'm wanting to do because it's just not worth it. All right, let's talk about the non-pharmacological strategies, right? Because you've got a lot of folks out there and parents, and remember, this is stage 0. It's always over in the obesity section that I'm covering. I'm in lifestyle medicine right now, so this overlaps very nicely. I always prefer a non-pharmacological treatment over a pharmacological treatment. I think it should always be tried first. I mean, unless if it's an emergency type of situation and you need a heavier hitter. But like if you're in an outpatient situation and you've got time and it's not an emergency, it's always best to see if a non-pharmacological strategy will work or at least get us a little bit better to where maybe we don't need as high maybe we need to use a med, but then we won't need as high of a dose when we get there. So there are non-pharmacological strategies to treat ADHD, and we're going to talk about it today. So first, the lifestyle stuff, right? I don't need to go into this in depth. I'm covering it in depth in the obesity medicine series, so listen to that. It's stuff like nutrition, exercise, avoiding substances. I'm going to talk about caffeine specifically today. It's kind of a substance. It kind of falls into the lifestyle modifications. It's kind of a supplement. We'll talk about that. And then sleep, right? Sleep hygiene is so massive in ADHD. People with ADHD tend to have just bad sleep patterns at baseline. Like their brain just does it, right? It's not just the behaviors and what the disorder does to them. It's also just, it's kind of a part of the disorder that they have a sleep problem. And then we're giving a medication, a stimulant that could then make that worse. And so it's very important to follow sleep hygiene stuff. And the other thing is, a lot of people might look like they have ADHD, but it's really they're sleep deprived. And I'll tell you a story about that right now. Patient was sent to me for an ADHD evaluation. I end up determining, and he had all the symptoms, concentration, like all the ADHD stuff was going on. But I'm doing my evaluation. Guy's just like, he's waking up multiple times at night. So his sleep is poor. Why is he waking up? To pee. Why is a 27-year-old male waking up to pee so frequently? I'm not even exactly sure why. It wasn't because he was drinking too much fluids. He had this interesting symptom where he said that, and not that it's semi-related, but not have to be 100%. He was a gay man, and he said that when he would poop, he would get an orgasm. And so I had this theory that he didn't necessarily have an enlarged prostate, but that maybe the anatomy of his prostate, because to have an enlarged prostate at that age just is very unlikely. But maybe the anatomy of his prostate was such that it was pushing against his colon. And then, if you massage the prostate, you can actually cause sexual arousal that way. And then also, if his prostate's kind of like blocking his ability to urinate, it's gonna look like he has an enlarged prostate. So I don't know. I gave him Flomax, tamsulosin, the alpha blocker, and just out of the crazy idea that I had that this might work, and it did. The concentration symptoms resolved, the sleep problems resolved, the peeing all night resolved, and I sent him to his primary. I consulted with the urologist, and I was like, "What do you think could be going on here?" And they were just like, if he's doing better on this med, then keep him on that med. And then I sent him to his PCM to have his prostate kind of physically examined, because I certainly wasn't going to do it as a psychiatrist. And they said that they didn't feel like it was like misshapen, or like that there be, of course we want to screen for cancer, right? Maybe he had some sort of weird cancer that was presenting at a young age, or but they examined it, they didn't find anything wrong, stay on the Flomax, and I sent him back to his primary care, and I assume that he's taking that and it's treating his ADHD, right? So I mean, this is just kind of an example, and especially when you're talking about kids, like if their sleep is messed up because of the ADHD, or just because they're not getting good sleep and they don't have good sleep hygiene and they're not sleeping well, they're going to suffer with concentration issues, right? So that's a huge one. I would say out of all the lifestyle factors, sleep would be the one, when we're talking about ADHD, that would be the most important. Of course, avoiding substances. I mean, if you're taking meth at night, that's certainly not going to be helping either. Or if you're caught, I mean, if you're taking downers that, like, are the opposite of a stimulant, that's not going to help you, right? And then, exercise is so important. And I think especially for kids, and especially for hyperactive kids, right? So, if they're not getting that energy out somewhere, it's going to come out in inappropriate places. And this is why, we need recess. When I was a kid, we had PE every day. We had recess every day. And I'm still confused as to what has been added to replace that. Because I see kids doing things in like ninth grade that I was doing in sixth or seventh grade. So it's like their academics appear to be even slower than it was when I was there. And they're only going to PE like 1 or 2 days a week, and they never have recess. And their lunch is also like really short. This is a huge beef I have. I think I mentioned this in the previous podcast, but it's like, bring back PE, bring back recess, bring back lunch. Kids need a break. They need to get the energy out. I mean, maybe one of the reasons why we're having more ADHD problems is because we're not using some of these lifestyle factors. Our nutrition has gotten worse. We're not letting these kids run around and get their energy out. They're not able to focus. You can't have someone in school all day long trying to focus on things. Even if you don't have ADHD, that's a challenge. They need a break. And they need to be able to run around. And like, this is probably another reason why the obesity rate's going up, because like we're not letting kids exercise as much. So these lifestyle factors are huge, right? You let someone run around more, let them play sports, you get them healthier foods, avoid substances, have better sleep. It's massive. And if you want to learn everything you ever wanted to know about lifestyle modifications, I already have my first episode on lifestyle medicine out from last week. And it's probably going to be about 6 more of those. All right. Maybe more. All right. Next, social interventions. Okay. So what are some social interventions? We talked a lot last time about adult ADHD, and I do focus on adult ADHD. About, like, people were drawn to these particular professions. Remember, that was like stock trader, neurosurgeon, trial lawyer, right? So it may be, get the right job, study, get the right degree, or don't go to college, be a mechanic. A lot in the military, what I notice, especially with adults, is that a lot of folks, maybe they had ADHD when they were growing up, and then they, got off of it, because you can't join the military unless you've been off of it for like 2 years or something like that. And then they do fine. And then they're in for a while. They get some leadership positions. They get some admin work. They're behind the desk. They're like an enlisted E6 rank, or E5, E6, fifth or sixth level enlisted, and they're no longer turning cranks anymore. And now their ADHD comes out, right? Because now they're right. So it's like, get the right job. If they were still turning cranks and doing what they loved, like a lot of these people, they really complain. It's like they want to increase in rank because they want more money, right? They want more money, and they want more respect, right? They want to call less people, like they want to have to like address, they want to be respected by more people. And if you're a higher rank, then you have more people that are under you, which, feels better for your status, right? Makes sense. But I think this is part of the problem. It's like, why do we value the office worker and the manager more than the person that is doing the technical work? Like, why do they get paid more? Like, and here's the thing, we often promote the wrong people. We promote the people that were the best at doing the technical work, but these are not necessarily the people that will be good managers. And it's often the people that were not as good at the technical work that actually would be more suitable to be a manager. But then they don't get it because being a manager is a reward. It's like, oh, here's more money, here's a promotion, here's more benefits, right? And I'm going to give that to the person that was the superior performer. And it's not that, this person is a superior performer because they tried harder necessarily. It could just be because they were better at it and liked it more. And the person that didn't would be a better manager, but then they never get to that place. And so this is a huge problem with the society and the way it works. This is the whole get promoted to the level of incompetence, right? It's like you just keep getting promoted because you keep performing well until you get in a job that you don't perform well in, and then they keep you there rather than moving you back down to the thing that you actually performed well at. And so, and in the military it's kind of a problem because it's like you can't keep turning cranks, as you get higher in rank. I mean, I was in the Air Force before, and I was a manager, and I absolutely hated it, right? Like, I probably looked like I had ADHD, and like I couldn't pay attention to meetings. I absolutely despised it. And so what did I do? I got the right job. I still knew I wanted to be like an officer, and I wanted to be a professional, but I wanted to turn cranks, right? Like, I wanted to fix computers. But I was supervising people fixing computers. So I said, you know what? If I go to medical school, I can basically be a technician, but a professional at the same time. So that was a huge thing that led me into what I do, right? I like to be a technician. I don't want to manage things and go to meetings and deal with all this garbage, right? Like, I'm just not going to do well at that. It's probably why I didn't promote beyond where I did as a physician. But that's fine. I got to continue doing what I liked, which was seeing patients and treating patients. And so it is frustrating. And I'm thinking, hey, these people like are less good at treating patients than me, but they got promoted maybe because they did whatever to get managerial positions. And then they're getting more money and I'm saluting them and stuff. And it doesn't feel great, right? But that's the where society is organized. I'd like to think of everyone as kind of equal, and it's like everyone has their role in society, and it's like we need people doing this, and just because you're doing that and I'm not doesn't mean that you're lesser than me. It's like I wouldn't necessarily want to do that, even if it might be considered an easier job. Like, it's not easy for me. I wouldn't want to do it. I would hate it, but you may like it. And so I'm happy that you do, because we need people to do that job. And so I think a huge thing with ADHD is, if you have if people are in the right job, and I think that if you have ADHD, there are certain types of jobs that you are going to enjoy more and you're going to excel at more, and you should figure out what that is. Do a search. I just gave you some ideas. I think a lot of more technical work where you're solving problems with your hands, or and for me, solving with my mind, but like they're like puzzles, right? Which is something that like I enjoy doing, or someone else might enjoy. They might enjoy trying to learn how to fix a truck or whatever, and they don't want to run through a check sheet and an algorithm and follow all this stuff. That's boring. They want to get in there, look at how it's, and they could stay in there all day doing that with their ADHD with no treatment, right? So get the right job, right? So next, social intervention, be with the right person. That's another thing. Um, you may love this person and you may be attracted to them, but like, are they somebody suitable for you to be with your ADHD symptoms? That may be why your relationship's not working, because like your ADHD symptoms don't mix well with this person. So being with the right person, like, this way you got to be real careful about getting married. Make sure like you know each other, and you want to be with somebody, I think, more importantly than anything, that accepts you for who you are, that's not looking to change you. And don't, and the message out there to all those other people, people don't change in the way that you want them to change. People can change in certain respects, but in the way that like people in relationships want someone to change, people don't make those type of changes. They are who they are. If you don't like what's in front of you, then leave it. Or if you like something about that person but don't like something else, accept the thing that you don't like. Say, you know what, I really like these things about this person, but I don't like these other things. They're not going to change. Can I live with this or not? Can the positive qualities they have overrule this? If not, then go to a different relationship, right? And so I think it's really important in any relationship that you accept somebody for who they are, because I mean, this is the person you're spending the most amount of time with. Do you really want to be with somebody who who you're forcing to not be what they want to be? And do you really want to be with somebody where you're having to change who you are around the person you spend the most amount of time with in order to keep them around? Probably not. And so, I mean, that this is like relationship advice for anyone, but like specific to ADHD, this person needs to know that what your limitations are and accept them. Okay, so be with the right person. There's educational interventions we can do socially. So this applies more to like school age and college kids. So like, this could be like giving them more time, having like a 504 plan. I mean, is it called a 504 everywhere? Um, and what is it? Individual education IEP, right? So you've got IEPs and you've got 504s. Like, so this is like you have a diagnosis and then you can actually get like a little more time for an exam, or maybe you get to fiddle around with like a fidget spinner, or you can sit on a bouncy ball instead of a chair. I've heard and seen all types of stuff. I don't deal with kids that much. Folks that do know more about that than me, but there's a lot of educational interventions. Honestly, I think it's probably gone a little bit too far. A friend of mine is a professor, and she's has been annoyed at the level of some of this stuff that's going on out there. I think it's gotten a little bit out of control. We need to have a little bit more uniformity, but I think a certain level of educational interventions for medical issues is definitely needed, and that can help as well. All right, and then parental training. So just like kind of educating, and this is for kids, so that parents kind of understand what they need to know and deal with to uh, handle and educate and raise a child with ADHD. Right. So those are social interventions. Next, psychotherapy. So, psychotherapy actually works for everything, even schizophrenia. I've even heard of psychodynamic therapy for schizophrenia, and people might think that's crazy, but no pun intended. But yeah, it's actually out. I mean, it's not the same, but you can like therapy. So meditation can be helpful. Coaching, I'm going to talk about, um, and then so some of these topics that I've mentioned, I'm going to dive a little deeper into. I'm just doing some broad strokes now, and I'm going a little bit more into depth into the ones I'm not going to talk more in depth about later. Um, but yeah, once we get through these, I'm going to go more in depth on some of these topics. This is an overview, and then another one. Many of you may have heard of EEG feedback, so that's electroencephalogram. So like that's the thing that neurologists use to see if you have a seizure, but it's a feedback thing where like you see your own brain waves. But from what I've heard about this, it's really expensive and it's not that effective. It's something that's out there. I guess if you're wealthy and money is like not that big of a deal to you, and you want to avoid meds and you've tried a lot of other things, it's something you could consider. I'm sure it does help and work for some people, but I think because of the access and cost of it, it's certainly not something that I would recommend for most. And then there's the trigeminal nerve stimulation. I think most of you have probably never heard of that. I'm going to go into more depth on that later, so I'll just kind of leave that as it is right now. And then digital therapies, another one I'm going to go into detail with later. So I will leave you in suspense for now on that one. All right. Um, let's talk a little bit about diet. There's a lot of there's a lot of stuff about diet out there for everything, but there's a little bit of evidence for some dietary recommendations, and I'm going to go over what those are. And I mean, I would say eating a healthy, mostly plant-based, whole foods diet, and doing all the stuff that I'm going to talk about on the other season of obesity medicine would apply to ADHD. You can't go wrong with that stuff. It's just good in general. Um, but specific to ADHD, let's talk about a couple of things. So, a few things to avoid, right? And so, this is in the news a lot right now, the artificial colorings. There is, and this is just in general. And my stance on this is that, do we need these dyes? I mean, I don't think they're as bad as maybe people make them out to be. I think they're a very small piece of the problem. I would target other stuff before I would target dyes. But like, do we have great evidence that they're bad? I mean, maybe a little bit, but at the same time, do they serve any purpose whatsoever? Um, Arguable. I think perhaps, I mean, there's some things to say that like a color might help you identify something over something else, and that can be useful sometimes, especially in people that have maybe some perception um, issues of difficulty discerning certain things. So I've heard about color being used to kind of help people to know what things are, especially people that might have some sensory deficits. There's also um, it can make things more appealing that maybe we want to make appealing, and it's like there might people that have like issues with like eating certain foods, and perhaps coloring it might help them to eat foods we want them to eat. So like there are some arguments that you could be in favor of food dyes in like some small set of the population, but I think in general dyes are used to get you addicted to things that are ultra processed and bad for you. And most of the stuff that has dyes in it are things that like I wouldn't recommend eating in the first place. So I like, I mean, I say get rid of the foods that have the dyes in them, and then the dyes go with them. And of course, when I say get rid of, I mean like if you want to fix your diet and eat healthier, don't eat the foods that have the dyes in them, because the foods that have dyes in them are generally worse for you. I'm not saying that we need to ban them. People should have their choice about what they're going to put in their mouth, but they also need to have the information about how safe or good something is for them. But yeah, I would generally say when it comes to dyes, I just don't eat the foods that they're in, and that kind of solves the problem. Am I that worried about the dye? Nah, I'm much more worried about the ultra processed crap that the food is made out of than I am the dye. But might as well not eat the dye too. Um, but let with ADHD, there is some information that artificial coloring can worsen ADHD and cause hyperactivity in some kids. In fact, the California Environmental Protection Agency's Office of Environmental Health Hazard Assessment Report of 2021 made such a statement. So there are some reports out there that would suggest that avoiding artificial coloring, and it's not every color either, it's certain ones, but like there is some evidence. So I think if you're trying to do some natural things to help your ADHD or your kid's ADHD, I certainly would say nothing's lost by getting rid of artificial colors, because you're probably going to improve your diet if you're not eating foods with this in there anyway. And then you're eliminating this as well. And maybe it's a small factor. So why not? All right. Here's another one to avoid: sodium benzoate. So, since sodium benzoate, which is a preservative, I believe, rich beverage consumption is associated with increased reporting of ADHD symptoms in college students. A pilot investigation. This is a study from 2014. That was the title of it. So um, perhaps sodium benzoate. I like to eat things that are fresh, don't have it in there. All right. So once again, if you're eliminating processed food, ultra processed foods, you're probably getting rid of sodium benzoate as well. But there is some evidence to suggest that ADHD symptoms might be worse in those that have a sodium benzoate rich beverage consumption. All right. Next. The effects of a double-blind, this is the name of the trial, right? The effects of a double-blind, placebo-controlled artificial food colorings and benzoate preservative challenge on hyperactivity in the general population, a general population sample of preschool children from 2003. So this was one where they were taking both artificial food colorings and sodium benzoate, and they found that hyperactivity was worse. And it was, it's marginally worse, but like if you're looking to kind of, get every little bit of juice out of that orange, why not eliminate these? And maybe there will be a slight improvement, and I think you'll probably be better off overall anyway. All right, and then the last thing I have to avoid is, here's the study's name once again: associations between exposure to bisphenol A, and I don't know, behavioral and cognitive function in children with ADHD. A case control study from 2020. So bisphenol A, it's something that could be in the environment. I'm not totally sure like where this is. I mean, this is BPA, right? There's a lot of these things, like these chemicals that are like in plastics and things like that. I think that's what this is. They did show that there might be some increased ADHD stuff with the bisphenol A. And then let's look at some natural treatments, right? So these are things to avoid to maybe make a marginal difference. A lot of stuff has been looked at to help with ADHD, and I'm going to give you the list of things that have been looked at, but like it didn't really show much benefit. So if you were thinking about using this, maybe you should think twice about spending your money on it to help with your ADHD. Kava kava, valerian root, St. John's wort, ginkgo biloba, ginseng, lion's mane, multivitamins, tryptophan, L-carnitine, L-threonine, amino acids. These are all things that are kind of marketed as helping with ADHD, and we just don't really have any evidence that they work. And so I'd probably save your money. But at the same time, if you're taking something like this and you feel like it's giving you some sort of benefit, go for it. I don't think any of this stuff is necessarily bad for you. I mean, St. John's wort can have interactions with a lot of medications, so that would be one to be careful on. Valerian root, it has some serotonergic qualities, so like that could have some effects on other medications. And then kava kava, there's some lower grade kava kava that has been linked to liver problems, and so you might want to be. So those three I would just be more careful with, because they do have some risks attached to them. The other stuff, the only risks would be if they were tainted or not like what they actually said was on there. But like, I'm not aware of any risks associated. I mean, ginkgo biloba may have some drug-drug interactions, but the rest of that stuff is not really. All right. So, and I've got a couple of supplements here that show maybe some evidence. It's unclear. We don't know, but it's a maybe. Melatonin's one. I talked about the sleep, wanting to get the sleep good. Melatonin might help with sleep in those with ADHD. It might be mostly placebo. It's probably mostly benign. So that's something that you could consider, especially in kids. But like, don't dose it too high would be another suggestion. And then magnesium is another one that's being looked at. If you want to know more about magnesium, I have a whole episode on magnesium, particularly all about it, but also about its treatment of depression. So if you, in all the different formulations. So if you're interested in magnesium, just listen to that episode. It might help ADHD, but there's just not enough information to tell us that that's the case. And I just wanted to bring this up because it's in the news. The whole Tylenol thing with autism. I don't know if you remember a couple episodes ago where I told you about this study, and it was a 2019 study from Johns Hopkins in JAMA Psychiatry and the use of acetaminophen in pregnancy. And not only did it show an increased correlation of autism spectrum disorders, of between 2.14 and 3.62 times increased risk. ADHD also between 2.26 and 2.86 times increased risk. So you may remember that I actually talked about this report, and it's in the news now. And they're just talking about the autism part, but I also mentioned that the ADHD part was in there. But I want to remind you of the qualifiers I said here, right? So the risk of fever that disrupts daily life, the risk of fever or pain that disrupts daily life gives you a higher risk of any of this than the acetaminophen does. So don't avoid it at all costs, because fever and pain are probably going to affect your pregnancy more. Also, not mentioned in the news, but the fact that this study said that they found no correlation for use of up to 8 days. So 8 days, it was less than 8 days did not show any increased risk. So if you used it for a week total, the correlation was nothing. It was 1.0. Like there was no correlation at all. Also, those that wrote this paper did not intend to kind of have any kind of conclusions of such a high magnitude drawn from it. The authors actually have stated, we do not believe that acetaminophen causes ASD. So even though they see this correlation, they're not really sure why it's there. They think it's probably not even that. And I've heard that there's some genetic factors that may explain this, but like, I just wanted to bring this up because those of you that are listeners to the show may have remembered that I talked about this. And now that it became this massive thing in the news, I just wanted to make sure that I was clear about my stance on it. That my recommendations would be, I wouldn't use it willy-nilly. I would limit the use, just to be cautious, but I would not forego it if it was needed, right? If this is getting in the, if this is what's helping with something you really need help with, especially fever, but pain that's like disrupting daily life, and this is going to relieve that, take it. But if it's just kind of like you thought, oh, it's completely harmless, I've got a little bit of an ache, I'll take some Tylenol, but like I probably could have like just not done that. I think that's a good thing to do in all pregnancy related things, that like if you don't like need it for something that's like moderate to severely impacting you, that you should probably avoid medications in general unless you like actually need it. If a doctor recommends you take it, I would take it. All right. So I just want to make that clear, because it does relate to ADHD as well, which is what we're talking about. And so let's get back to diet, right? So I mentioned melatonin and magnesium were kind of maybes. The supplement that we have the most evidence for is omega-3 fatty acids. All right. I did a whole episode on omega-3 fatty acids. So if you want to know everything about omega-3 fatty acids, go listen to that episode. But I'm going to tell you about this trial in ADHD right now. So here's the title: Omega-3 fatty acid supplementation for the treatment of children with ADHD symptomatology, a systematic review and meta-analysis from the American Journal of Academics Child Adolescent Psychiatry 2011. It was a meta-analysis of 10 trials. There were 699 children in the study, in the meta-analysis. However, many of the studies were poor quality and had poor blinding. So these were not great studies, all of them. The effect size was 0.31. And the studies that had higher EPA versus DHA actually showed a higher effect. So doses around 750 milligrams of EPA actually correlated with a closer to 0.5 effect size. So this is nowhere near what the stimulants are going to get us, which is closer to 1.0. I've seen everything between like 0.65 and 0.8 and 1.0, and even higher, actually. 1.7 I've even seen. So the stimulants, and we'll talk about that when we talk about stimulants are way more effective. But if you don't want to use stimulants, you don't want to give your kids stimulants, you want to try other stuff, which I think you should do. That's stage 0, remember. Omega-3s is something that you might want to consider. And I always say go with the real deal. Give them some salmon. We'll talk about omega-3 rich foods in the lifestyle podcast as well. I'll talk about which fish are the highest. It's not just salmon. It's the smash fish. See if I can remember them offhand. Salmon, mackerel, anchovy, sardine, and herring. And to me, everything on that list except salmon is not appetizing to me personally. So I go with, and salmon, it's a little bit more costly. I go with the salmon. We'll talk about that more. So yeah, um, omega 3s is definitely does have effect. So it might not be enough, but it might be something definitely to think about. All right, next dietary item: the role of iron and zinc in the treatment of ADHD among children and adolescents. A systematic review of randomized clinical trials in the journal Nutrients from 2021. All right, so in this one, we had ADHD symptoms correlated with low iron and zinc. So basically, people that have low iron and zinc seem to have more ADHD symptoms. We don't know if that's causing it or not. It's a correlation. Correlation's not causation. It's interesting. We need to study it more. There were with supplementing iron and zinc. Not really anything was shown with iron, but there were some modest effect sizes seen. I don't have the exact numbers for zinc. So a little bit more evidence for zinc, probably only if you were low in zinc in the first place, and pretty modest. But like if you're low in zinc, you should probably take it anyway. And if you want to know about zinc, hey, I had a whole episode on zinc. Look at this. All the things that I talked about in depression also are the ones for ADHD. We talked about magnesium, we talked about zinc, we talked about omega-3s. These are the ones I think are the most important for mental health. Iron is always important, but as we saw here, iron was not all that useful for ADHD. All right, here's one last dietary study. It's called The Effect of Dietary Approaches to Stop Hypertension. So that's the DASH diet. I don't like this diet because it's low in salt. I just find it tasteless. It's basically the Mediterranean diet without salt, with low salt. Okay, so the approach with the DASH diet on ADHD symptoms, a randomized controlled clinical trial, was in the European Journal of Nutrition from 2021. All right. And what they did was, so it's a diet of fruits, vegetables, fish, whole grains, nuts, beans, avoiding sugar, salt, saturated fats, cholesterol, refined grains. I'm down with all that except for the avoiding salt piece. Do not take my salt away. Do not take the punk rock psychiatrist salt away, or you'll get bit. That's one thing I'm not giving up is my salt. I will go to my grave with my salt. So yeah, all that other stuff I agree with. So next, so the DASH diet had significant improvements on multiple parent, teacher, and child-related measures of ADHD after 3 months. There was about a 2 to 3 point difference from the control on a 30-point Connor scale. So that some sort of Connor scale, it was like an adjusted Connor. It was like Connor scale, and there was about a 2 to 3 point, like of course control always gets better too when you give people controls, but there was a 2 to 3 point. They didn't calculate the effect size, which is what I always like to see, but there was a difference. So once again, I mean, this makes sense to me. I would prefer the Mediterranean diet over the DASH diet, but like to each his own. This is a healthy diet. I would say it's healthy. I would say it's a flavorless, saltless diet, but it's a healthy diet. And so here we're talking about eating healthy food. Makes sense, and it was marginal improvement, but an improvement. So there is a reason to eat healthy besides weight. It helps with mood, depression, ADHD. Now we're seeing, right? So this, and we're going to see a lot in my other season about how it affects mental health. All right, and they also noticed that pro-social behaviors were improved, and there were fewer conduct problems as well. All right, and then one more on the diet. So this is a Danish registry study. So the Scandinavian countries that keep track of everybody and everything, we get great data from them because they have so many. they have so many patients in their studies. This is a 2025 study. So this just came out. I may have mentioned this before in my updates episode. I can't remember. 60,000 mother-child pairs assessed at age 10. The child obviously is age 10. And they were given a Western dietary pattern during pregnancy was associated with neurodevelopmental disorder in childhood and adolescence. A Western dietary pattern, otherwise known as the SAD diet, otherwise known as the SAD, Standard American Diet, a diet that I despise, but that I grew up on and loved for many years and I have let go of. So it was associated with neurodevelopmental disorder in childhood and adolescence. There was a significant association with ADHD and autism diagnoses. So moderate shifts along this dietary spectrum associated with 66% increased risk of ADHD and 122% increased risk of autism. Remember, correlation is not causation, but like, why not improve your diet? And here, this is suggesting that improving your diet could decrease the risk in your child of ADHD and autism. I'd probably like hold off on not on the Tylenol if you need it issue, but like, why don't we report this? Why isn't this study in there? You know, why is Tylenol in the news, but like eating a healthy diet isn't? Could it be because the food companies are strong arming everyone and they want us to eat garbage so they can make more money? Could it be? I think it probably is. Tylenol's is owned by a big company too, but this is just one tiny company with one drug. The food industry is massive. It's massive. It's everything people eat every day, right? So they probably don't want us reporting this. But yes, I recommend you eat healthy because it could actually decrease the risk in your child, right? So this is a mother-child pair, okay? Diets high in fat, sugar, and refined products. This is what was in that Western diet. So high in fat, sugar, refined products, low in fish, vegetables, and fruit. And the association was strongest in early pregnancy. So here we go. Don't give up your Tylenol during pregnancy, but give up your Western dietary pattern and eat healthy. All right? All right, man. I have a lot left to say. I'm probably going to have to wrap this up sooner than I was wanting to. But I do want to, I definitely want to talk about caffeine. Let's talk about caffeine because my theme song is about caffeine. So I have to cover this slide. All right. So a lot of people, they think that caffeine helps with their ADHD symptoms. So let's dig into it. This could be a supplement. Hey, maybe this, people say, oh, I give my kid coffee and their ADHD symptoms are better. So how does caffeine work? It blocks adenosine receptors in the brain, and these adenosine receptors decrease dopamine. So by blocking them, we're increasing dopamine. What do the stimulant medications do? They increase dopamine and norepinephrine. So makes sense. It's a different mechanism. Caffeine's doing a similar thing to the stimulants. And hey, caffeine is a stimulant. This is why it increases dopamine. So this is making sense, right? Helps with wakefulness, vigilance, cognitive, and physical performance. If you're going to the gym or doing a workout, I recommend two things. All those crazy supplements that people are selling for like freaking $30-$50 a can that lasts you like a month, those powders, you can throw that stuff in the trash or don't waste your money. Finish it. The only thing you really need is creatine and maybe some caffeine. All right. So also can help with physical performance. It can worsen sleep. This affects some folks more than others. People metabolize things differently. They have different issues with sleep. Some people have no issues with sleep and they can drink caffeine in the evening. Some people actually sleep better if they drink coffee because, I don't know, I guess it calms them down and helps them get to sleep. So everyone's different. There was a study that showed 100 milligrams of caffeine worsened children's behavior. Withdrawal headaches can be severe if you basically, problem is caffeine doesn't last very long, a couple hours, and then it wears off. And then a lot of people get withdrawal symptoms, right? So all the benefits they're getting go away. They can get headaches. And especially if you drink coffee or caffeine every day. And I would say coffee is a good thing generally. I don't like coffee personally. I just don't like it, so I don't drink it. But like almost every study I see shows that coffee's good. And in fact, it's one of the only ways that the sad American diet gets any fiber into it, because people are not eating their fruits and vegetables, but they're drinking their coffee, and they're getting fiber through the coffee. So if they didn't have their coffee, um, they probably have even more unhealthy guts with unhealthy gut microbiome and you know difficulties going to the bathroom and so forth. Um, but there are downsides, right? So withdrawal headaches can be severe. Um, some people, it's just as long as they have their 1 or 2 cups a day, they don't get the withdrawal, right? But some people, they get the withdrawal right after, and they're drinking tons of cups all day long, which is probably not a good idea. It can raise blood pressure by a few points, which is similar to stimulants. A lot of people don't like the stimulants, but they're like, oh, it raised my blood pressure. Barely. Uh, Bupropion probably raises it more. So the stimulants, they have a little bit of an impact, about the same as caffeine. It can work similar to stimulants for attention, but tend to have more adverse effects, and higher doses are needed than the stimulant for the same effect. So it's like, why would you use caffeine when you could just use a stimulant? They're doing very similar things, but you're having to drink more, have more caffeine more often, more impact on sleep, more side effects. Just take the stimulant, okay? Um, and so a lot of folks are on stimulants, but they're also on caffeine. And so if you combine caffeine and stimulants, they can synergistically cause these adverse effects. And so, when you add the stimulant, one reason why they're not tolerating it could be because the caffeine combined with it, right? And so the answer may be decrease the amount of caffeine. Um, and then sometimes if somebody decreases their caffeine, we may need to increase the stimulant dose to counteract the fact that the caffeine's not in there. So just kind of keep this in mind. Caffeine works very similarly, but it does not work as well. It just doesn't last as long. It causes more adverse effects. The stimulant and it causes basically all the same problems, and more. And so I would advocate for the stimulant medication over the caffeine. But like, it's something, everyone's different. If you like caffeine and you're tolerating it well and it works for you, then go for it. All right. I'm going to make this episode a little bit longer so I can finish this up. All right. So this will be a little bit longer episode. Let's talk about some coaching strategies, right? So coaching is different than therapy, because like, these people don't have to be licensed therapists. They don't need the master's degrees and stuff. They're just kind of like helping somebody. They're like a mentor. All right. I remember on Seinfeld, there was an episode where like this woman that I think George was dating, or and maybe Jerry was dating, and she had like a mentor, kind of, which is basically like a coach. And he found this kind of strange, and he thought that, and then he tried to replace the mentor with himself. And I think the mentor may have been a man. He was threatened. So I don't know, that when I think about coaching, I always think about that episode. And then he found that he like didn't like the role he had taken on. But what are some coaching strategies, right? You can coach as the psychiatrist or psychologist or whoever's listening to this show, or I can coach you, patient who's listening, right? So what are some things we could do? Set up time in your schedule to take care of specific tasks. So people have difficult time organizing with ADHD. They have a difficult time being on time. And so it's like, set up times in your schedule to take care of tasks. Like, have a schedule, put it in your phone, put it in a planner, whatever works for you, right? Use a planner, stick to the plan. And things that other people might just get to on their own that you don't, say, do this thing at 2 o'clock in the afternoon on Tuesday. And then you knock that thing out, because other people, they're just getting stuff done. But you might need to actually schedule that. Okay. There's nothing wrong with that. And in fact, you can become more efficient than those people because you do have this plan and schedule. So set alarms. Um, I mean, I've already admitted to you that I think I probably have a touch of ADHD. I don't take medication. I've tried it before. Didn't really work. Kind of felt like it made it worse. So I manage with a lot of this stuff. I have a lot of spreadsheets. Like I've told you before, I'm highly organized, but my highly organized behavior is all like computer assisted. I use databases, I use Excel spreadsheets, I use Word documents, I use the notes in my phone. I have I have a list, I have a grocery note that says anytime I see that I'm running out of something or remember I need to buy something, I open it up, I get the note, I go to the grocery note, I add the thing. Every time I'm at the store, I look at the list. That way and of course I forget things all the time, and I always kick myself. I'm like, that's why you look at the list every time. You didn't think there was anything on there, but then you forgot that you had added something. And then as soon as I get it, I delete it from the list. So I've got a grocery list. I've got a to-do list. I have a check sheet note with the little radio buttons that you like check things off. Every time I take a trip, pack your bag, do your laundry. Do you need a plug converter for the place you're going? Um, Make sure that you've sorted out your garden stuff, and you've prepared for if a typhoon comes while you're gone. Like I basically have this huge list, and if there's anything specific, like I'm visiting someone and I'm bringing them a gift, I'll add it. I'll be like, make sure you pack this because you'll need it on this trip, and I leave it on there until I've had that trip, and then I'll delete that item off. um, I have lists that I do for everything because I forget things so easily. And so and then I have alarms. And then I put things in the calendar. Everything goes in my calendar on my phone. It's and then I have, like I said, I have alarms. I use the notes. I use the reminders. If the reminders I use if it's a specific time that I want to take care of something, a note is like if I'm in the grocery store, if I'm packing, or if I'm doing something. It's a check sheet of things to do, right? And if I adhere to this, I maintain control over this inability to remember anything. I remember to task wise, I remember nothing. And so my entire life is scheduled. I have an Excel spreadsheet for um, what my activities are, all that I do during the month. Um, Anytime I do a trip, I have it all like what dates. So you just you these are all ideas that I'm giving you. And I don't know, this probably sounds overwhelming, but the fact is you build this up slowly and you integrate it into your life, and it ends up saving you a tremendous amount of time in the long run. And you have to stick to it, because that ADHD thing in your brain is going to say, I don't need to look at that list. I don't need to check. I've done the list a million times. And then you forget something, right? Or I don't need to add this. I'm going to remember. I really need it. And then you go to the store, you don't get it, you come home and you kick yourself. You've just, and I know it's annoying, and it's like you feel like a baby, but like it works. Trust me. When you have the thought, write it down, and write it, and you write it down the form you need. If it's something you need to do by a specific time, put it in something that's going to set off an alarm. If it's something that you need to do when you go to a certain place and you have a check sheet for that, have a note check sheet for that. If it's something that you don't need on the go all the time, don't have it on your phone, have it on your computer, and reference it whenever you're doing something. A task, it's like, okay, I'm doing this task, I'll reference this thing I made on my computer and I'll look at it. Because some things are maybe too big or complicated to put on a phone, right? So make short term, intermediate term, long term plans, right? Like, what do I need to do in the next month? What do I need to do in the next year? What do I want to do long term? Have a list of things to do. My to do list, I have it broken up by like time periods. And some of those things are just like, if I get to it, I get to it. Like these are just ideas. Like if I'm bored and I don't know what to do and I'm trying to think of something, I've got it on the list. Oh, let's look at my list. Oh yeah, I was going to do that. Why don't I do that today? It's not like important, but like it's something to like fill my day. Or, I might, well, I lost the train of thought there, but just keeping these lists of things that you can like remind yourself of. In fact, I should look at my phone right now. I'm going to open it right here on the air with you. It's gonna be a long episode. So I've got a to-do note. I have a grocery note. I have a thing when I go back to the U.S. of products I can't find in Japan where I live. It's a list of things to buy at the grocery store to bring back with me. I've got my prep for leaving list. I've got a password list. Um, I've got a podcast list. This is like when I have ideas about the podcast to put it in there. And then once I put them into my stuff, I take it off of there. I've got a to-do list with my kids, so like it's a shared list. So if they want me to do something or I want them to do something, we add that to the list. I've got a cheese I like list. So there's a cheese store I go to, and like he makes all these really interesting cheeses. So like every time I really like one of the cheeses, I add it to list. So when I go to the store, I'm like, do you have this one? Do you have this one? Do you have this one? That way I always get the cheese I want. I've got a movie list. It's like a list of movies that like um, when I feel like watching a movie, it's ones that I want to see. Um, and then I've got like a phone list of like how to call certain kinds of numbers over here. So just to give you an example, and then I've got my reminders, right? Oops, and it's to cancel a couple of credit cards by a certain date so I don't get charged the annual fee, right? So these are just some examples of how to plan your life out and keep it orderly. I have people's birthdays programmed in my phone so that they remind me. I have like when I play hockey in there to remind me like all my flights that I take, all of my hotel stays, like all that goes in the calendar. Any doctors, I have a doctor's appointment tomorrow. That's in my calendar. I'll scan the week and see what's in my calendar every day so that I don't forget to do things. I know this may sound insane, but like when your brain works the way mine does and like the stimulants just aren't your thing, it's good, right? So have the planner, use a paper book, wall calendar, an app. I've got some paper stuff that I'll stick things on, and it's a combination. Figure out what works for you. Another thing is to stay organized, right? Because those of us with ADHD, and I think I'm probably one of them, we forget things all the time. So everything you own needs to have a place and always keep it in the same place. That's why it kills me when someone in the house moves one of my things, because like I always have my stuff in the same place, right? So that I do not forget about it, right? Because I will, and then if I take it out of that place, I better darn well put it back, or I will completely lose track of where it is. So it's really important to kind of organize your space to where you have a place for things and you keep them there. Um, Other strategies: use your words to benefit yourself and those around you. All right, so that's something maybe more to teach younger people. Hopefully older people learn that. Automatic bill pays. People that have a hard time remembering to pay bills, use the automatic pays. Anything that you can automate, the better. Reminders and alarms on apps, clocks, smartwatches, sticky notes, kind of talked about that, but those are some other ways of doing it. um, have things delivered to save time shopping. So if you're like short on time, and it's something that you order a lot, do like the automatic order thing. That way you don't have to forget. You don't forget to get it, and you don't have to like waste time going to the store to pick it up. Um, Creating a system for managing electronics. So this would be like not using your electronics all the time. So um, have a place to put your phone at night and time to turn off electronics, because that's going to affect your sleep. All right. So those are some coaching strategies. Hopefully you gleaned some cool stuff from that. I just have two more things um, that I want to talk about. I want to tell you about the external trigeminal nerve stimulator. So this is a device. It's made by Monarch eTNS system. It was FDA approved in 2019 as the first and only medical device for ADHD. It's only approved for ages 7 to 12. You wear it on your head. The trigeminal nerve, medical folks, you guys know what that is. It's the fifth. I hope I got that right. Fifth cranial nerve. It's the sensory nerve of your face, um, and you can get trigeminal neuralgia, which is like a chronic pain of the area that nerve innervates. It's really really extreme. So you wear this thing. It's connected to a little like kind of handheld device, and it delivers low level electrical pulses. The patch is attached to your forehead at bedtime. The trigeminal nerve near your eyebrows is you've got the trigeminal nerve. It's in like there's like three. It's like trigeminal nerve 1, 2, and 3, and the one on the forehead. So near the eyebrows is a significant pathway to critical brain regions associated with attention, mood, and self-control. And so you guys have probably never heard of this thing, Like, how well does it work? Well, I looked at the trial results, but of course, it's probably by the company who did it. It showed a decrease in a scale, and the scale that I mean, I don't have good details on, like, they don't have the effect size, but what I have is what numbers they went from and to, right? So folks that used the eTNS system started at 34.1, went down to a 23.4. Those that used placebo started at 33.7, so about the same, went down to a 27.5. So it's about a 4 point difference. So it seems like it probably provides some benefit. So those that don't want their kids on medications, this is another option for you. I don't know how much it costs or like how easy it is to get this prescribed or whatever. But this is another option. And it, like a lot of the things I've talked about today, none of this stuff works as well as stimulants, by the way. None of it. So this is because we're trying to avoid using a stimulant. What are our other options, right? Our non-medication options that are not as good, but could be enough, right? Like I said, I think the coaching strategies I told you about are enough for me. So there are some warnings. If they have a pacemaker, active implantable neurostimulators, or insulin pumps, it's recommended. It's not just recommended. Don't use it. All right. So that would be something that would prevent you from using it. And then let's wrap up with the digital therapies. So these are like video games that are supposed to help you with your ADHD. There's a couple of them. There's this one called Endeavor RX. So it's Endeavor, but it's like prescribable. It's a video game. It's FDA authorized. It's for ages 8 to 12. And that came out in 2019. And then the Endeavor OTC came out in 2024, and it's authorized for adults. And that one's available in app stores without a prescription, but the Endeavor RX, you actually have to download it and then get a prescription from your doctor and then use that to like unlock it so that it works. And I found a study on this, and it wasn't done by the company, but it was a meta-analysis, so it probably includes the studies done by the company. So it's titled Effects of Game-Based Digital Therapeutics on ADHD in Children and Adolescents as Assessed by Parents or Teachers, a Systematic Review and Meta-Analysis from the European Child Adolescent Psychiatry Journal from 2024. And they showed that in their study, medications improved inattention with an effect size of 0.62, which I think is on the low side of what meds actually do, but it's still a pretty good effect size. And the game was 0.28. So, I mean, 0 would be no effect. So, I mean, it's a pretty low level effect, but like everyone's different. Some kids may get a better effect size than others. That's just the average. And then on hyperactivity, they didn't have something for meds on that one. And it was also a 0.28 effect size for the Endeavor game on hyperactivity. So it actually does do something. It's like you play this game and you accomplish these tasks and things, and it's supposed to help like your brain learn how to multitask and do things better like that. So um, another option, right? It's another option out there, and it might help. And then the last one I have is another digital therapy. It's called Skylar's Run. Also came out in 2019. It's a video game. It's not FDA cleared. It's kind of neat though. I don't know how good it works, but you wear this thing on your head and you use your own brain waves from an EEG headset to control this character, Skylar. And apparently that's supposed to help. Hey, I don't know if it does. I don't have like any studies on this one because it's not FDA cleared. There's like not much information on it. That other study was on the Endeavor system. So, I mean, it was a meta-analysis. So it was a few studies that have been done combined, probably all by the company. But regardless, we talked about a lot of things, and these are like probably effect sizes between zero point 0.3 and 0.5 at the best, which is maybe half as good as meds at best. But hey, we talked about some diet stuff, magnesium, melatonin, avoiding like artificial coloring, and some preservative omega-3 fatty acids might help. Zinc is a possibility. A Mediterranean diet or DASH diet. Caffeine we talked about as a potential but like I actually think it's probably best not. I do not recommend caffeine. We talked about some coaching strategies. We talked about the external trigeminal nerve stimulator. Talked about some digital therapies, and these are the things I would say that could potentially work. And so there's a lot of options out there, and I think we only think about stimulants, but like if I'm going to give someone a med, I'm going to go with a stimulant. But best not to give them a med, and maybe try some of this stuff. All right. So today's song that I have selected is Black Coffee by Les and Jake. I picked this song because we talked about caffeine. All right. That was basically why I picked that song. And it's a great song from their first major studio album, Pezcore. So recommend the band. I've used a lot of their songs. That's an early album of theirs. I like all their stuff. I like their early stuff, their late stuff. They're great. So I hope you enjoyed the episode. You learned a lot. You really feel like, hey, I'm gonna give some different treatments out there, and maybe I'm gonna fix my freaking diet and exercise and stuff, and maybe we're gonna get PE back into the school. I'm gonna advocate for my school to put that stuff back in there, because that's gonna help kids. So thank you so much for listening, and I'll see you next time.